It's Dr. Frank here at PFRANKMD, and today we're talking about, well, it's not hot and new, it's actually been around quite a while, but it is a hot treatment, and we call it AquaGold. So AquaGold is a name of a microneedling device that we're using here, and what we're doing is we're performing a treatment that they've developed actually in Europe called skin boosting. And skin boosting is when we take a little slurry of active ingredients like filler or Botox or and other types of active ingredients. And what we do is we microneedle it into the superficial layers of the skin. So in our AquaGold treatment, the PFRANKMD version of it, we create a slurry of Restylane Silk, which is a great skin boosting device for hyaluronic acid hydration and smoothing, and also one of any of the neuromodulators, Botox, Xeomin, Dysport, the newer Juvo. And what we're doing is we're microneedling through these, I don't know if you can catch this on camera, but you're microneedling through these little gold needles here. Let's see if we can get this at some point. What they do is they pop out. Now these hollow bore needles, what they do is they're delivering this little slurry of neuromodulator and filler mixed with a little sterile normal saline. Now the question is, why are we actually microneedling neuromodulator and filler into the skin? It has been shown to have a biological effect different than actually injecting it deep into the skin. First and foremost, hyaluronic acid is a normal component of the skin. It hyperhydrates, it brings in hydration, and it can actually smooth out fine lines and wrinkles. Also, using neuromodulator, if injected superficially into the pores, it could do several things. A, it could shrink the pores. B, it could actually make the pores less oily, so your skin is not as oily. And finally, what it can do is it can have an effect on the flushing of the skin. Very common problem in people of all ages, flushing, redness, some people with rosacea, and it's been shown that it can actually affect the vasculature of the skin. So we have this young lady here today, and I'm going to talk about the type of patient that this is perfect for. There's really no one that can't benefit from it, but this young lady's actually getting married soon. And she wants to do something to brighten her skin, smooth out her skin, help with some of the redness and uneven skin tone, but she's way too young to need deeper injections. And this is great for this early stage patient before doing injectables. They want to make something to kind of smooth out the skin and brighten it, something that's going to last and something that's not too traumatic. And this is perfect for her. The other type of patient is maybe the older injectable patient who already does neuromodulators like Botox and filler, but they want more of an icing on the cake. They want to get into those little fine lines that you can't do deeper injections for. In fact, we do skin boosting on patients who maybe don't have the downtime for much stronger resurfacing procedures like Fraxel repair or other types of CO2 lasers. So there's really a wide spectrum of patient that this is great for, and it's really not traumatic. You want to avoid makeup for a few hours afterwards. I usually say 4 to 6 hours. And really what you're doing is, it feels, I started here a little bit before, she's a little bit red, but basically what you do is you prime the needles so the fluid starts going through it, and then we're microneedling it into the skin. And this is actually a procedure that my nurses will do. I'll tell them the formula of what we want to do. And sometimes you get a little bit of pinpoint bleeding, which is normal. It shows we're puncturing the skin. And you can see a little bit of the fluid on top in the delivery of the microneedles. It is normal to be red. She's someone that probably gets red a little easier than most, but it's a very simple procedure. You are not only getting the effects of the active ingredients, the neuromodulator and the filler, but you're also getting the collagen stimulating effect of the microneedles themselves. So if you get a microneedle, why not do it with some active ingredients? We do at times use PRP in this slurry. Some people want to stay away from active ingredients like neuromodulator and filler, and we can use PRP for collagen stimulation. But this AquaGold device is really very ergonomically simple. It's very time efficient. This whole thing will take about 5 or 10 minutes to do her whole face. She'll be able to go to work tomorrow without any issue. Once you create these little micro channels, you could actually rub the stuff that's on top to make sure it gets into the micro pores. Obviously, you want to stay out of the sun for a few days after this, but putting on makeup the next day, it's really no problem. So the question is, when does this actually get better? When do you see the end result? I usually tell people a week. You want to do this anywhere from a week to a month before a big event. The effects of it are gonna last just like any other Botox or filler treatment. You'll probably get about 4 to 6 months out of it, and it's certainly compatible with any other cosmetic treatment you may be doing. I wouldn't do laser right on top of this, but you can do laser about a week later. You can do it right after doing neuromodulators and fillers on the face. It's a great add-on. And you can see the little microchannels that are being made in the skin. We rub the slurry on there. We don't want them to wash the face right after. We literally just want them to leave as is, because we want the absorption of the product to get right in there. I think that's about it, guys. We're gonna finish up with this. And if you have any more questions, you could DM us or give us a call, PFRANKMD.